Let me say something that might make you a little uncomfortable. If your pet's breath smells, that's not just bad breath. That might be infection. And here's the scary part. By the time you notice it, your pet has probably been in pain for maybe months. And today, I'm going to show you exactly why most owners miss this and what's really going on inside your pet's mouth. I'm Jenny Vet Nurse and I'm DrVet's assistant, and I'm going to let you in on a little secret. Dental disease is one of the most common problems we see, and also one of the most ignored. And honestly, I get it, because your pet isn't exactly booking themselves in and saying, "Excuse me, I think I have gingivitis." Here's the problem. Pets are incredibly good at hiding pain and discomfort. In the wild, showing weakness equals danger. So instead, they keep eating, they keep playing, they wag their tail, and all the while, their mouth could be full of infection. I've seen dogs come in, wagging their tail, still happy, with teeth literally rotting in their mouths. And later in this video, I'm going to show you one sign that almost everybody misses. And when you see it, you're never going to ignore dental disease again. Let's break this down simply. It starts with plaque, the soft, sticky film on teeth. If it's not removed, it hardens and forms into tartar. And that tartar is where the real trouble begins, because bacteria love it. And that leads to inflamed gums, infection, pain, and eventually loose and rotten teeth. Basically, it's like a tiny horror movie happening inside your pet's mouth, and they're just casually eating their dinner like nothing's wrong. Let's talk about smell, because I hear this all the time. "Oh yeah, the breath's always been really bad." No, that smell could be bacteria, could be infection, could be decaying teeth. If your dog's breath could knock you over from across the room, it's not a personality trait, it's a medical problem. And this is the part that gets me, because these pets, they don't complain, they don't tell you it hurts, they just get on with it. And I've seen so many cases where owners say, "I had no idea," and I believe them, because the signs are subtle. Here's what you should actually be looking for. Bad breath, that's the big. Drooling more than usual, eating slower, chewing on one side, dropping food on the floor, pawing at the mouth, or in bad cases, red and bleeding gums. And here's the sneaky one, still eating normally. Yes, just because your pet is eating does not mean their teeth are fine. This is the one that catches people out. Dogs will eat socks, rocks, and things that you don't even want to know about. Trust me, a painful mouth is not going to stop them. If dental disease is left untreated, it doesn't stay in the mouth. It can spread into the bloodstream and affect the heart, the liver, and the kidneys. So what starts as just bad breath can become something much bigger and more serious. Let's talk about solutions, because this is the part everybody wants to know about. First one, yes, I know you're going to hate it, it's toothbrushing, but it is the gold standard. Think of it this way. If you didn't brush your teeth for 3 years, you wouldn't feel great either. Dental chews, helpful, but not the magic cure. Diets or dental kibble. They can reduce build-up of tartar, but again, not enough on their own. Professional dental cleaning. This is the big one, because once tartar is there, it needs to be removed properly. And please, don't fall for the anaesthesia-free dentals. They may make teeth look cleaner, but they don't treat the disease under the gum line, and that's where the problem lies. Let me be honest with you. Most pets over the age of 6 already have some level of dental disease. So when I said at the beginning, your pet's teeth are worse than you think, I wasn't exaggerating. So what can you do today? Check your pet's mouth, lift their lip and have a look at the gums. Start brushing, even if it's just a few times a week, it will help. And book a dental check with your vet or your veterinary nurse, because catching it early makes a huge difference. At the end of the day, your pet trusts you. They rely on you, and they can't tell you when something's wrong, but you can learn to spot the signs. If you found this helpful, please like and subscribe to DrVet, because we are here to help you help your pets. So remember at the beginning of the video, I said there's one sign that you absolutely cannot miss when it comes to dental disease. This is it. A change in how your pet eats. Not stop eating completely, because let's be honest, most dogs would eat through almost anything. I'm talking about a subtle change. The ones that most people don't realise are important. So what does that actually look like? This might be taking longer to finish their food, dropping biscuits out of the corner of their mouths, chewing more on one side than the other, suddenly preferring softer food over crunchy, picking food up and then dropping it, or walking away and then coming back later. These are not just little quirks. These might be signs of discomfort. Why this matters, and here's the part that's really important. By the time the eating changes, dental disease is usually already quite advanced. So if you're seeing this, your pet hasn't just developed an overnight problem. They've likely been dealing with it for weeks or even months. And I can't tell you how many times I've seen this in practice. An owner comes in and says, he's just been a bit fussy with his food lately. But when you actually have a look in the mouth, there's infection, there's inflammation, and there's quite often loose or damaged teeth. Let me say something that might make you think your pet might be eating, but that doesn't mean they're comfortable. They're just coping. And this is where pets are very different from us. If we have toothache, we complain, we avoid food, or we tell someone. And pets don't do that. They just adapt. They slow down, they chew differently, they just put up with it. And because of that, it's incredibly easy to miss. So from today, I want you to do one simple thing. Watch your pets while they eat. Not just if they eat, but how they eat. Are they chewing evenly, finishing meals normally, comfortable and relaxed while they're eating? Or is something just a little bit different? Because that small change, that hesitation, the chewing on one side and not the other, might be the only early warning sign you get before things become more serious. And the good news is, if you catch dental disease early, it's much easier to treat. Less painful for your pet, less stress for you, and often costs less as well. But it starts with the owner noticing. I'm Jenny Vet Nurse, helping you notice things your pets can't tell you. See you next time.